And yes, our conversation is about to start on something very important. Odipa will do us the honor.
Definitely. Today, we are talking about dental anxiety. I never knew this was a thing until I came across this topic. And I'm very excited that we're going to talk about it today. And to do that with us is Dr. Adedeji Kowobari. He is a dental expert and the lead concierge dentist NG. Welcome to the show.
Yeah, good morning.
It's
Good
good to have you.
morning. You're welcome.
Yeah,
Thank
it's
you
nice
for joining
coming
us this
here
morning.
again.
You know, I didn't know it was a thing. What exactly is dental anxiety?
Okay, dental anxiety is a term used to describe any form of worries, possibly fears that a potential client or even a former client or patient has as regards dental treatment or going to the dental clinic. So it's like a term used to just summarize any form of worries that anybody has towards dental treatment. Based on experience, I will say again that the primary thing that causes anxiety is ignorance.
Okay, ignorance.
Yes, ignorance coupled with wrong information or misinformation. Yes, so what's the source of the ignorance is when you hear stories from people who have been to the dentist before.
Okay.
Yes, so that form of gives a kind of idea, a wrong perception of what the dental experience could look like for an average person. So when you hear, you went to the dentist, it was painful, it was this, it was that, you know, a lot of people think that they will have the same experience too, but what they don't understand is that the bodies differ. And the experiences will definitely differ. A case in point, some medical doctors will tell you that some people who, based on experience, don't even express as much pain as others when it comes to child delivery.
Yeah, true.
You understand? So there's what we call pain threshold. Our pain threshold differ. So there could be Mr. A who, with just one pinch, will scream as if everywhere is on fire. While Mr. B, if you punch him or you even prick him with a needle, it might not even express as much pain. It could just like, this is just a discomfort. So when Mr. A goes to the dentist and start giving Mr. B his experience about being at the dentist, then Mr. B now has a kind of mindset of, you know, the dentist, and this can lead to anxiety. Yes.
So just before we came on the show, you were talking about how there's a thin line between dental anxiety and dental fear.
Yes.
I want you to address that.
Okay, dental anxiety, like I said, it's just like a term used to describe any form of worries someone can have about going to the dentist. Now, the dental fear is like a more chronic or severe form of dental anxiety. So dental anxiety will lead to dental fear.
Dental fear.
Yes, so most of the time when someone, because of the anxiety or because the person is anxious, keep missing dental appointments at the detriment of the oral health or the teeth or any other thing. You know, that is definitely fear already. Yes, so dental fear is just like a chronic form of dental anxiety.
All right, so I'd like to know, do we have any age limit to whom can be affected of dental anxiety? Since you already explained that this is most time based on ignorance. So is there any age grade of whom can be affected by dental anxiety?
Anybody can be affected by dental anxiety. And saying that it's based on ignorance initially doesn't totally mean that is the main cause of dental anxiety.
All right.
And that will lead me to the next thing I want to say, that there are different causes of dental anxiety.
Yeah,
previous experience could be a cause of dental anxiety. Yes, and also post-traumatic stress disorder. Someone who has been through stress before, someone who has been through trauma before can you know, express, can be anxious about going to the dentist. Yes, that could also cause dental anxiety. Some mental conditions, someone who is schizophrenic, someone who is bipolar, you know, can, you know, express dental anxiety. So there could be different reasons why people have anxiety towards being to the dentist.
Okay, so what are the signs and symptoms that one can easily use to tell, aside the fact that, yes, they will be scared, you know, they would be skipping appointments, yes. You know, what are the other signs that it presents? Okay,
from the dentist's perspective now, for me to know that someone is anxious, someone could be sweating profusely. Even under a good working AC. Yes, it could be sweating profusely. The person could just be restless on the chair. The person could be restless. The person could be breathing very hard. Yes, and there could be palpitations. Yes, palpitations, breathing deep and fast and hard, sweating profusely, just being irrational, trying to just being restless generally. Yes, those could be some of the symptoms of dental anxiety.
So what do you do when all some of these things happen? For instance, I come to your chair and I want you to do something for me, but I am very scared. I'm palpitating. I'm sweating profusely. What do you do to calm me down, to make me know that everything is going to be all right? In no time, you'll be done with this procedure.
Okay. Well, this one it's a good one. That's when it comes to the dentist handling someone who is anxious, because like I said earlier, like I tell some of my colleagues on some of our platforms, every dentist needs to have this mindset that a patient coming is definitely anxious because of the ignorance I said. I'm not saying all of them, but most of them. So the primary thing I believe dentists should do, or that I do, is to educate rightly.
Okay.
Yes. You see people come to the clinic and after examination, you tell them, okay, this is what we're going to do. We're going to do a filling. You know, it got to a point, I jokingly tell people, even if the dentist tells you, I want to make you up, I want to do makeup for you, the next thing you hear is it going to be painful? So you can see that everybody, almost everybody, you know, that's the next thing they will ask you. Anything you tell them I want to do. So the first thing I do, which I believe most of my colleagues do, is to properly educate about what is going to be done. So there's something we call tell, show, do, where we first tell you what we want to do. Then we'll possibly show you or we simulate or show you the instruments we're going to use to do it. Then now you can now rest assured to know that, well, we can now do it on you. So most of the time, the first thing is to properly educate and tell the patient, okay, this is what I'm going to do for you, step-wisely. Because one other reason why when people are anxious, which when people are anxious, they don't even bother to question the dentist.
Okay.
So anxiety leads to that. It can prevent someone from questioning the dentist. So that's now to the part of the patient. If you want to solve dental anxiety, you can just relax and ask the dentist, what are you going to do for me? How are you going to do it? Some people think the dentist can be offended by asking, how are you going to do it? You are not trying to ask if the dentist is competent or not. You're just trying to tell the dentist to show you how it's going to be done. So, you know, by interacting with the dentist, asking relevant questions, not too much irrelevancies, you know, it can help calm the patient down. So from the part of the dentist also, the dentist also needs to be open to, you know, educating the patient about what is going to be done. Yes, so that's one of the first things we do. Other things we do, distractions.
Okay. What sort of distractions?
Well, distractions work well with kids.
Okay.
Yes, children, you know, it's almost rare to find a child who is not anxious, especially the first visit. Yes, so most of the time, at times in the clinic, you can play music. At times, you can give the child some things to play with. Sometimes, even the glove, you can wear it in the hand of the child. You can make a balloon with the glove. Just allow the child to play. That's why even in the dental session for kids, it's always beautiful. It's always colorful. It looks like their school. It looks like their playground. And, you know, those are some things that we use to just distract their attention. And even when we want to give things like injection, there are some things we can do at times. We don't want them to even see the needle at all. So there are some terminologies we use. We don't want them to even hear the word syringe. We don't want them to even hear the word needle, because we know that almost every child has been to the hospital before they come to the dentist, so they know what it looks when they hear the word injection. Even adults are scared of the word injection. You know, where for example, when I want to do an extraction or a procedure that requires injection, the first thing an adult, a typical adult or an average adult asks me, is it going to be on my bum bum? And I tell them, no, it's not going to be on your bum bum. It's going to be somewhere on your gum close to the tooth I want to. Yeah, even you. Your expression right now is like... So a lot of people, it's the first time they come to the dentist, they hear the word injection in the mouth.
They're like, oh my goodness.
Exactly. So there's a lot of education. There is some distractive methods that can be used. There is the calming the patients down from the part of the dentist. There is the trying to familiarize with the patients, ask them how your day was, you know, what did you eat today, trying to just know one or two things about them.
You know, from what you've been saying, I think I have dental anxiety. I'm serious. Because I can't remember the last time I've been to the dentist. I don't think I've ever, maybe just once.
Okay.
You know, and then I know a couple of times I've had issues with my teeth, but then I'll just, it just goes. So I don't bother going to the dentist to ask questions or check. So is that let's say a thing? Is that a problem? Is it dental? Has he gone into dental fear now? You know?
Well, it may not be fear yet because ideally you should see your dentist at least twice a year for just routine checkup. One other thing we do at times to help patients who are anxious calm down is we start from less invasive procedures to more invasive procedures.
Okay.
For example, if a patient comes to the clinic and they need to get their mouth washed, they need to fill a tooth, and they need to get a tooth extracted.
Okay.
We try to start from cleaning the mouth first because that is less invasive. We're just using a particular instrument that is vibrating to clean the calculus off the surfaces of the teeth.
Okay.
Yes, then filling, we can now talk about drilling. Now, if you can bear the vibratory effects of an ultrasonic scaler, for example, then we want to graduate to something that can be drilling. Maybe it could be a caries or a hole that is not too deep, a cavity that is not too deep, that would even require injection.
All right.
So normally, scaling and polishing doesn't require injection, so we clean for you. Then we can say, okay, we schedule a visit, come a week's time for the filling to be done. So because you've been introduced to a dental procedure that wasn't painful, you can be excited to come the next week for the filling.
All right.
This filling, an injection was not introduced. We just did little drilling of the part of the tooth so as to put a normal filling there. Then in the upper week or even that same visit, we can now bring out an injection. So you can see that there's a gradation from the less invasive procedures to the more invasive procedures.
Okay, so I want to ask this question because it's personal to me, and I've visited the dentist I cannot count. Wow. And I don't want to say that I have dental anxiety, but I want to know what it is that's wrong. Because the last time I went to the dentist was probably the last time I told myself that I'm not coming here anymore. Because I was in so much pain. Wow. I went to extract my...
Can you see?
I said, previous experience. I said, I wasn't. I didn't say it was painful. I was in pain. I guess it was because maybe I was going through some other things. My gum was swollen, and then I wanted to extract a tooth. I was having serious toothache. I couldn't bear it anymore. I had to go, and the dentist said, you have to remove this tooth. And when I was done, I think I did... no, it was just the day before that, because now that's why I was saying that you're very correct, say, from less invasive to more. Before that, I'd filled a certain part of my teeth. Then they asked me to come back, and then my gum was swollen. They had to remove that tooth. I was in so much pain, too much pain. So after that time, even if I have a little pain in my tooth, I'm like, you know what, I'm going to be fine. Nothing is I'm going to be all right. So what would you call that?
Okay, before I answer your question, a few things. When she said she has lost count of the number of times she's been to the dentist, you know, when people hear that, they want to think, this person's tooth is so bad. Now, it's ironical. Someone who has been to the dentist so many times is someone who we like. Not because we are making money when you come, but because that person is more dentally conscious and more dentally aware than someone who has never been to the dentist. Some people go to the dentist just for routine checkup, and they've been there many times, and that's very good. Compared to someone who hasn't even been there at all, who claims, I've never had any problems, so I've never been to the dentist. So people even say proudly, but that's very, very wrong. You know, so then the second thing I want to say from what you said is some of the experiences that people share about being to the dentist, most of them are not even from what happened when they were on the dentist chair.
Okay.
Some of them happen afterwards. For example, after an extraction, you're given an instruction. We give you so many instructions, actually. Now, some clinics do well by printing instructions so you don't forget. But these instructions are very, very important because those instructions will determine how fast or how good, you know, the extraction socket, if it's an extraction, will heal. Or even if it's any other procedure, how effective the procedure would be. Because we don't want to keep you down in the clinic until the procedure is complete or some other things like that. So sometimes when you tell someone you need to do warm water with salt after extraction 6 to 8 times every day for the next 1 week, a lot of them are like, no, how am I going to remember that?
Most people don't do it.
So if you don't do that, there's a very high chance that the extraction sockets will not heal properly, and that could give further pain. So some people are like, you know, after the extraction, my gum was swollen, blah, blah, some other thing. I'm not saying the gum can be swollen in some cases, but sometimes people just kind of blow the situation out of proportion. Exactly,
right.
yes. So now, to your case as regards the anxiety and everything, well, the major issue for you now is previous experience.
Yes.
Yes, so going forward, if you have to go to the dentist, which I think you should for your normal checkup.
I'd love to. I'd
Yes.
love to, but I'm always very scared. I've missed a lot of appointments.
If you have to go now, just be calm. Yes, just try to calm yourself. Try to go like someone who has never been to the dentist before. Then
Is that even possible?
it is. It's a mindset.
Okay.
Then when you get there, interact with the dentist and ask questions.
How about if the dentist is a hostile one? Because I know we have, I'm sorry, but I know we have a lot of medical practitioners that are not very nice. They're not, I'm not saying everybody
don't have that
bad,
patience
but it's
to
not
attend
everyone
to
that
you.
is very patient. It's not everybody that is very nice. It's not everyone that's going to explain to me how all the procedures will go like you were doing now. So what do I do in that case?
Well, the thing is, the condition in which the doctors are even working to. I'm not here to defend doctors, but at times, even before the doctor sees you for that day, the person might have treated about 10, 15 people, 5 more, some vigorous procedures and everything. But even if it looks as if the dentist or the doctor is hostile, there's a way even you yourself can still be pleasant about your questions, a little bit persistent about it. That's why I said earlier on, not asking irrelevant questions. There are some times where some people can't draw the line between relevant and irrelevant questions. So, but based on my own practice, one of the things I usually tell my clients a lot of times is calm down. I use that word a lot. And a lot of people don't know that the dentist knows when you are tensed. A very practical example.
Okay.
Because I work with the mouth. So most of the time, if I do like this, the reason why this is moving fast is because I'm not tense.
Okay.
But when I'm doing like this, and you're tense,
Yeah, he will move.
I just tell you, relax, relax. So most of the time, when I'm doing like this and you're tense, and I say relax, the person just relaxes and the thing moves. Because dental anxiety from the patient affects the dentist also.
Okay.
Because when you are anxious, it's as if I'm doing something against your will. So it can reduce my speed, not necessarily my performance or my capability, but it can reduce the speed at which I work on you.